Okay, so with that, hang on. We're telling followers. Ooh, someone joined. Hello. Um, so we're going to talk about what a concussion is today. So I think there's a lot of confusion. There's confusion on the patient side of things, and there's confusion on the doctor side of things. We've got research that a lot of doctors, even neurosurgery and neurology residents, don't really answer that many questions correctly when it comes to good morning. Don't really answer questions correctly. Hey, when it comes to answering questions about diagnosis, prognosis, and complications of concussion. And these are MD, neurology, family medicine, and neurosurgery residents. And then as patients, it gets kind of confusing. Like, was that whiplash? Was that concussion? Even when it's more severe, we'll kind of revert to just calling it a concussion because it was a head injury. So what is a concussion? So I was a hockey player growing up, and when I was growing up, I also played other sports. I played football, I snowboarded, I was a runner, which not really high risk sport there, but my main sport was hockey. And the idea around head injuries was that like I had to black out, I had to see stars, I had to ring my bell, like I had to hear, like I had to have tinnitus or ringing in the ears. And that was kind of it. And if I didn't experience those things right away, or even if I did experience those things, I was kind of weak, or I wasn't being tough. I wasn't being a man. I wasn't like overcoming it and like punishing my body for being soft. And the reality is that sometimes that comes with concussion, and sometimes that doesn't. So the importance of concussion, I think, is that it happens to a gob ton of people. We've got evidence that it's estimated that 1 in every 2 people, so every other person, 1 in 2 people globally will sustain some sort of traumatic brain injury, at least one in their lifetime. So every other person in the world is estimated to sustain some sort of traumatic brain injury in their lifetime, and 70 to 90% of those injuries are estimated to be concussion. So 90% of the people in the world might have 90% of every other person you see might have a concussion, which is insane. That's a gob ton of people. And it's not only athletes. There's a big emphasis. There's 3.8 million sports-related concussions a year. There's a big emphasis on concussion around football, lacrosse, rugby, ice hockey. But the reality is that most concussions happen because you fell over, a motor vehicle accident, something completely unrelated to, maybe not completely unrelated, but unrelated to just like a head impact. So with that, concussion, to differentiate concussion from other forms of traumatic brain injury, you've got to look at TBI is ranked as mild, moderate, and severe. And if you want a prettier version of this with like visuals, I actually did a TikTok for the youth of the world yesterday, differentiating mild, moderate, and severe, because someone had a question on that. But so there's mild TBI, which is concussion. Concussion is often in the literature and in the world synonymous with mild traumatic brain injury. So mild TBI, concussion. And to diagnose that, structural imaging is actually normal. So you won't see anything on a CT or an MRI. You may not lose consciousness. Loss of consciousness is 0 minutes, 0 seconds, up to 30 minutes. Anything more than 30 minutes and you didn't have a concussion, you had something more severe. Altered state of consciousness, so that kind of like disoriented feeling that like, oh, I don't know where I'm at. That lasts 1 moment to 24 hours. You could feel kind of wonky for up to a day. Post-traumatic amnesia, so memory loss related to the hit, does not last longer than a day. If it lasts longer than a day, you're looking at something more severe. And then there's something called the Glasgow Coma Score, so the GCS. And it's something are you blinking? Are you responsive to commands? Are you with it? Are you alive and not comatose, or are you trending towards a coma? And I believe it's 6 is the bottom number, but it's basically low number up to 15. And 15 is a perfect score. You can have a perfect score. You could have a perfect 15 and still have a concussion. So the takeaway here is you could have normal imaging. You could have not lost consciousness. You could only have a moment of feeling wonky. You could have no memory loss, and you could have a perfect Glasgow coma score and still have sustained the concussion. The only thing you felt was a moment of like, ooh, that was wonky. Hey, what's up, Dr. Kwan? Anything more than that, if you have abnormal imaging, if you lost consciousness for more than a half hour, if you have an altered state of consciousness for more than a day, if you lost memory for more than a day, if your coma score was somewhere between 9 and 12, that's a moderate TBI. For a severe TBI, you straight up lost consciousness for more than a day. You straight up lost memory for more than a week. Your coma score was low. It's bad. And that grading sets up some sort of expectation for what we can do in terms of recovery. I'm going to wave at people here. So mild TBI, when you have that normal imaging, you have less than 30 minutes loss of consciousness, a day or less of altered mental state, a day or less of altered memory, there's a lot we can do for recovery. As you get to moderate and severe, there's a lot we can do for progress, but 100% recovery becomes a lot more difficult. So I think two takeaways I want to point out here are a couple myths that are sustaining concussion, and that is you have to get hit in the head. There are still a lot of doctors that think you have to get hit in the head to sustain a concussion, and that is just not true, and we'll talk about that in a second. You can get hit anywhere in the body as long as your head kind of like whips around. Your brain has the potential to whip around, and that puts you at risk of concussion. So you don't have to get hit in the head. You can get hit in the head or the body. The force just has to be transmitted to your head, to your skull. The other thing is that the idea that you have to pass out. You do not have to black out. You do not have to pass out. You do not have to lose consciousness. Less than 10% of all concussions results in a blackout, results in a loss of consciousness. That means more than 90% of the time, people do not lose consciousness. So it's kind of a silly marker to think that I had to get hit in the head and I had to pass out, otherwise I didn't have a concussion. That's just not true. Not true. No evidence to support that. So you're driving in a car, you're playing, what's up, Tristan? You're driving in a car, you're playing hockey like me. How hard do you have to get hit? The research suggests, in terms of linear acceleration, not really translational or rotational, it's got to be 70 to 120 G's of force. Some data says that 70 is kind of like an erroneously low estimate. But bottom line, you got to get hit pretty hard. So putting some perspective on this, whiplash associated disorder, cervical strain, cervical sprain happens around 5 G's. So you kind of you get in the car accident, your head whips back and forth and you got headaches and you're kind of dizzy and you got blurred vision. Was that a concussion or was that whiplash? It's really, really, really difficult to tell on paper. And in terms of proprioceptive brain integration, it's a big gray area that we can talk about some other time. But basically, cervical strain, cervical sprain can happen at 5 G's. Concussion is estimated to happen 70, 120, 160 G's of force. So it's a big hit. And what goes on under the hood, under your skull, is that your brain it's soft and squishy. I've got a GIF or a GIF or, I don't know, it's a giraffe or a giraffe. I've got a little animation on my Instagram somewhere of this dude holding a skull model, and he hits it, and you can see the brain kind of jostle like Jello. And that is to say, that's another myth. Helmets don't prevent concussions because that Jello is sloshing whether the helmet is there or not. So what goes on under the hood is you got this Jello wiggling back and forth, and your neurons are all connected, and all the glial cells. 50% of your cells in your brain are actually just support. They're not actual nerve cells; they're neurons. So all these glial cells and all these neurons kind of stretch and shear, and there's a literal stretch and shear. And what that means is it makes concussion a functional traumatic brain injury. It's functional because nothing tore. We just kind of got this stretch and strain. And as we stretch and strain, all these electrolyte channels start to open up. And there's this excitotoxic burst. So this excitatory, toxic, because it's just crazy unregulated burst of glutamate and calcium, which are sort of these excitatory things that cause more glutamate and calcium to be released. So we stretch, electrolytes go everywhere. It's this crazy soup of like excitotoxic gunk, and that's the moment where we're like, ooh. There's a great video of Jonathan Tays, captain of Chicago Blackhawks, gets hit at center ice and he gets up and he goes back down, and then he gets up and he's like, oof, he's got this excitotoxic soup going on in his brain. And that's just what it is. So there's this stretching and the shearing, electrolytes going everywhere, this excitotoxic soup, and now your brain has to do something with all of that, for lack of a better word, all that shit just floating around. And we've got to push it back. We got to bring it back into place, and bringing it back into place takes a lot of energy. It takes a lot of ATP or energy, and that causes this sort of energy dip in brain metabolism, because in a cruel trick of nature, we take an impact 70 to 120 Gs, we stretch, there's electrolytes going everywhere. We're trying to put them back into place. We need a lot of oxygen and blood flow and nutrients and energy, but because of the autonomic dysregulation that happens in concussion, there's also a decrease in blood flow to the brain. So we see animal studies show that there's up to a 50% decrease in blood flow to the brain. So when your brain needs it most, you just got jostled, you just got hit to the chest or hit to the head, you fell, you hit your head on the concrete, your electrolytes are going everywhere, your brain is excitotoxic, you're disoriented, you're starting to get a headache, you don't know where you're at, and all you need is blood flow. There's about 50% less coming to your brain. It's a cruel trick of nature. So the three big things going on under the hood, there's a stretch and a shear that causes an excitotoxic inflammatory event to go on, and there's also a simultaneous blood flow deficit, which leads to this energy deficit. And that is that's kind of what's going on under the hood in concussion. And so, hey, Kamiko, I'll get back to your message later. So where was that? So under the hood, you got this stretch, you got this shear, you got this excitotoxic inflammatory soup going on, you've got a blood flow and an energy deficit, and that leads to you feeling really, really like garbage. And what you'll see is if your brain energy levels are up here, again, I've got a graph of this somewhere on my Instagram. If your brain energy levels are here, like up at 100%, in the first 3 to 5 days after a concussion, they'll just dip and they just go whoop. And then those first 3 to 5 days after a concussion is when you typically feel your worst. That's when the headaches are the worst, the brain fog's the worst, the anxiety might be the worst, your sleep might absolutely suck. That's just when concussion kind of gets the worst. And in most people, we see that in 7 to 10 days, energy metabolism hasn't restored yet. But we see in 7 to 10 days, symptoms start to go away. And that's a dangerous time, and we'll talk about that next week. But not dangerous, don't scare yourself, but dangerous in terms of be careful, make sure you're getting checked out by a doctor, make sure you're getting cleared before you go back to sport, to play, to whatever. But you got this energy deficit where 3 to 5 days, you start to feel terrible, 7 to 10 days, you start to feel probably better for most people, and then some people don't feel better, and that's a post-concussion bucket, which we'll talk about next week as well. So what are some of the symptoms you might feel? There's something called the post-concussion symptom scale, PCSS. It's a part of the SCAT-5, the Sport Concussion Assessment Tool, 5th edition. And there's 22 symptoms. There's headache, pressure in the head, neck pain, nausea, vomiting, dizziness, blurred vision, balance problems, sensitive to light, sensitive to noise, feeling slowed down, feeling in a fog, not feeling right, difficulty concentrating, difficulty remembering, fatigue, low energy, confusion, drowsiness, being more emotional, more irritable, sad, anxious, nervous, depressed, and then there's sleep trouble. And so you can see concussion after you jostle your brain, there's cognitive, emotional, and physical symptoms that occur. And one thing that's kind of tricky about concussion is that that diagnosis. A lot of doctors aren't quite sure what to do, and it really helps to have a baseline test, which is better for athletes because a lot of athletes have athletic trainers and doctors on the team that are doing baseline tests preseason. I have folks I'm using my phone. I have folks use the EQ app on their phone because we can get a moving baseline of their brain throughout the entire season, throughout the entire year. So if they ever take a hit, we've got data of how they were performing yesterday, not 6 months ago at preseason, which is pretty cool. So I want to wrap this up because I don't want this going too long. I'm not sure how long we've gone, about 15 minutes here. Wrapping it all up, Arizona's hot. It's been really hot this year. Concussion, you don't need to black out. It's not only getting your bell rung or seeing stars. You're not weak if you experience a concussion. It is a traumatic brain injury. It's an inflammatory injury. It's a mild traumatic brain injury. It doesn't only happen to athletes. Falls are a big cause. You do not need to hit your head. You can get hit in the body. The force just has to get transmitted to that jello-like brain of yours. Less than 10% of concussions result in a loss of consciousness. It's got to be a pretty substantial force that hits you, that causes a shear and stretch of your nerve cells, causes an excitotoxic inflammatory soup to occur, which leads to an energy deficit secondary to also a blood flow deficit in there. Your symptoms probably peak in the first 3 to 5 days. They should, in most people, get better in 7 to 10 days. And if they don't, that's a post-concussion bucket, which we will talk about, I believe next week or the week after, but I think it's next week. And there's about 22 symptoms. There's a god ton of symptoms that occur related to concussion. So next week, I've got it written down here. We're talking about the risk of post-concussion syndrome. So you get a concussion. How do we predict if you're going to have a longer recovery or delayed recovery? What kind of constitutes post-concussion? Why do you have it? And what are the best practices after concussion? Like, what should you do if you're at risk of concussion to prevent concussions, which we might not talk about entirely next week, but we'll touch on it. But largely, you've been hit. What do you do in the acute or the chronic stages? If you have any other questions, go ahead and comment or send me a direct message. Maybe I'll bring it up in one of these. These will be, again, weekly. And the exciting news, I almost forgot, the really exciting news, I will be in a new location, hopefully for the last time here. It's been a rocky 2020, but I will be in a new location. I am joining SNJ Fitness over near the Kierland. It's awesome big gym facility. I am only using the treadmills for concussion, but I will have my office there treating concussion, post-concussion, chronic pain, and then general wellness where we can do sort of the prevention stuff. Make sure your vitamin D, your omega-3, all the things we know that prevent head injuries and optimize performance are in check. So that is where I will be starting next week. I'm actually going to start moving my stuff in over the next few days. But yeah, so I will be in Scottsdale at S&J Fitness near the Kierland off of, I believe it's 74th and Helm. Yeah, so thank you all for joining. I appreciate you all. I hope you have a good rest of your day and your week.